You can't focus. Your mind is racing. You feel restless, overwhelmed, and behind on everything. You procrastinate. You avoid tasks. You feel like you're failing. Is it ADHD or is it anxiety? This is one of the most common and confusing questions in mental health. ADHD and anxiety share many of the same symptoms: difficulty concentrating, restlessness, sleep problems, irritability, and a constant sense of being overwhelmed. But the causes are different. The treatments are different. And getting it wrong can mean years of ineffective help. Welcome to the Health Sketchpad. I'm Dr. AB. In this whiteboard guide, we're going to untangle the confusion. We'll look at how ADHD and anxiety feel from the inside. We'll explore the key differences in attention, motivation, worry, and energy. And we'll give you a framework to understand what might be going on, so you can get the right support. This isn't a diagnostic tool. Only a professional can diagnose. But understanding the difference is the first step toward getting the help you need. Before we look at the differences, let's acknowledge why this is so confusing. ADHD and anxiety share a lot of the same symptoms. Both conditions can cause difficulty concentrating. Your mind wanders, you lose your train of thought, you can't stay on task. Both can cause restlessness. You feel fidgety, unable to sit still, like you need to move. Both disrupt sleep. Racing thoughts make it hard to fall asleep. Worry keeps you awake. Both cause irritability. You snap at people. Small frustrations feel huge. Both make you feel overwhelmed. Every task feels like too much. You don't know where to start. Both lead to procrastination and trouble completing tasks. You put things off. You start projects but don't finish them. With this much overlap, it's no wonder people get confused. Even professionals sometimes struggle to tell them apart. But the key is to look beyond the surface symptoms. ADHD and anxiety feel different from the inside. The thoughts are different. The drivers are different. Let's explore how. The most important difference between ADHD and anxiety is why your attention wanders. In ADHD, attention wanders because your brain is understimulated. It's constantly scanning for something more interesting, more engaging, more rewarding. You're not distracted by fear. You're distracted by boredom. Imagine your attention is like a radio. In ADHD, the radio keeps scanning for a stronger signal. It lands on one station, then drifts, then lands somewhere else. The problem is difficulty sustaining focus on anything that isn't highly stimulating. In anxiety, attention is hijacked by worry. You're not distracted because you're bored. You're distracted because your brain is stuck on a threat. It keeps returning to the same fear, the same what if, the same catastrophe. The radio isn't scanning. The radio is stuck on one static-filled channel. The problem isn't sustaining focus. It's that your focus keeps getting pulled back to worry. Here's a practical way to tell the difference. If you're distracted because your mind is jumping between a dozen interesting things, the project, the phone, the noise outside, a random memory, a creative idea, that pattern leans toward ADHD. If you're distracted because your mind keeps returning to the same worry, what if I fail? What if they're angry? What if something terrible happens? That pattern leans toward anxiety. Same symptom, different driver. Both ADHD and anxiety cause procrastination, but the reasons are completely different. In ADHD, you procrastinate because the task is boring. It's understimulating. Your brain craves novelty, interest, or urgency. If a deadline isn't imminent and the task isn't engaging, you simply can't make yourself do it. You'll do anything else. Clean the kitchen, organize your files, watch a video, scroll your phone, anything except the boring task. In anxiety, you procrastinate because the task feels threatening. You're afraid you won't do it perfectly. You're afraid of judgment. You're afraid of failure. The task feels dangerous, so your brain avoids it to protect you. You're not bored. You're scared. Here's a way to tell them apart. Ask yourself, if the task were exciting or interesting, would I still avoid it? If the answer is no, if you can focus easily on things you enjoy, that pattern leans toward ADHD. If the answer is yes, if you avoid things you enjoy too, because of fear of not doing them well enough, that pattern leans toward anxiety. Same behavior, different driver. Both ADHD and anxiety can feel like a racing mind, but the quality of the racing is different. In ADHD, the racing mind jumps between many different topics. One moment, you're thinking about work. Then a song lyric pops into your head. Then you remember you need to buy groceries. Then you're thinking about something that happened years ago. Then you're planning your weekend. The thoughts are varied, fast-moving, and hard to control. But they're not usually scary. They're just everywhere. In anxiety, the racing mind is stuck on one track. You replay the same worry over and over, the same fear, the same what if, the same conversation you wish had gone differently. The thoughts aren't varied, they're repetitive. They loop, and they feel threatening. Here's a simple way to tell the difference. Ask yourself, what are my racing thoughts about? If they're about many different things, random, varied, jumping around, that pattern leans toward ADHD. If they're about the same thing, over and over, with a sense of dread, that pattern leans toward anxiety. A racing mind, but one races in circles. The other races in every direction. Restlessness looks different in ADHD and anxiety. In ADHD, restlessness is about excess energy. You feel like you have a motor running inside you. You need to move. You tap your foot, bounce your leg, get up and walk around. Sitting still feels physically uncomfortable. This restlessness is often worse when you're bored or understimulated. It's energy looking for an outlet. In anxiety, restlessness is about nervous energy. Your body is in fight or flight mode, where muscles are tense. Your heart is racing. But you might not actually move. You feel restless on the inside, jittery, on edge, like something bad is about to happen, but you might freeze outwardly. You're too scared to move, but you can't relax either. Here's a way to tell the difference. Ask yourself, does movement help? If moving around, pacing, or fidgeting makes you feel better and more focused, that pattern leans toward ADHD. If movement doesn't help, or if you feel too frozen to move, that pattern leans toward anxiety. Both are restless. One moves, one freezes. Here's perhaps the most important difference between ADHD and anxiety: the presence of fear. In ADHD, difficulty concentrating is frustrating. It's annoying. It makes you feel like you're failing, but it's not usually scary. You forget an appointment, you get distracted, you procrastinate, you feel bad about it, but you don't typically spiral into catastrophic fear about what it means about you. In anxiety, difficulty concentrating is terrifying. You worry about what your distraction means. What if I can't focus because I'm losing my mind? What if I fail because I can't concentrate? What if everyone notices and thinks I'm incompetent? The fear feeds on itself. You worry about your worry. You catastrophize about your own symptoms. Here's a simple test. Ask yourself, when you can't focus, what happens next? If you feel frustrated but move on, that pattern leans toward ADHD. If you spiral into fear about what it means, if you worry about your inability to focus, if you feel a sense of doom, that pattern leans toward anxiety. The presence of fear is the best differentiator between these two conditions. What if you've watched this entire video and you're still not sure? What if you see yourself in both columns? Here's the honest answer. That's common. Up to 50% of people with ADHD also have an anxiety disorder. The two conditions frequently occur together. You may have both. ADHD may be causing your anxiety. Anxiety may be mimicking ADHD. Only a professional can sort this out. So here's what to do if you're still confused. First, see a professional. A psychiatrist, psychologist, or even a primary care doctor can do a proper evaluation. They have tools and training that no YouTube video can replace. Second, track your symptoms. For 2 weeks, write down when you can't focus. What was happening? What were you thinking about? How did it feel? This information is gold for a diagnostician. Third, be open to both possibilities. Don't lock into one diagnosis. The treatment for ADHD and anxiety is different. Stimulants help ADHD, but can worsen anxiety. Anti-anxiety medications help anxiety, but don't treat ADHD. Getting it right matters. You deserve an accurate diagnosis. You deserve effective treatment. And you deserve to stop guessing. Let's bring this all together. If you've been struggling with focus, restlessness, procrastination, and overwhelm, and you've been telling yourself you're lazy or broken or failing, I want you to hear something important. You are not lazy. You are not broken. You are not a failure. Your brain may have a different wiring, and that wiring may be ADHD, anxiety, or both. But understanding which one is the key to getting the right help. ADHD and anxiety share symptoms, but they have different drivers, different thought patterns, and different treatments. ADHD is about understimulation, a scanning radio, and boredom-driven distraction. Anxiety is about threat detection, a stuck radio, and fear-driven distraction. ADHD procrastinates because tasks are boring. Anxiety procrastinates because tasks are scary. ADHD's mind races in every direction. Anxiety's mind races in circles. ADHD's restlessness moves. Anxiety's restlessness freezes. And the presence of fear is the best differentiator. If you're still confused, see a professional. Track your symptoms. Be open to both possibilities. You deserve clarity. You deserve support. And understanding the difference is the first step.